Hello, I'm Dr. Rachael Haverland. I'm an endometriosis surgeon here in Dallas. And today the question is, please discuss the difference between endometriosis ablation and excision surgery. And this is a new topic. Endometriosis excision has been around for the last 10 or so years, and we're learning more. And most of our data is actually extrapolated from the fertility literature. We learned that by excising endometriosis rather than ablating or burning the disease, we had better pregnancy rates, both with natural pregnancy and with IVF. And we extrapolated from this data that these women who had improved chances of fertility, their pain also improved. They had a longer pain-free interval, is what we call it. So endometriosis ablation surgery is typically also laparoscopic, but where you burn or cauterize the surface of the disease. Endometriosis excision surgery is where you go in, identify the lesions of endometriosis, and dissect around the lesion. I like to explain this as like an iceberg. You see the ice above the water and you melt it down to the ocean level and it looks good, but you don't want to drive your boat there because you don't know what's underneath the water. So when we see endometriosis, it's important to make sure you're excising, especially for deep infiltrating disease, but really for all disease, to make sure you're looking behind the lesion and removing all abnormal tissue. So typically I dissect back until I find normal tissue, and then everything in front of that comes out and is sent to pathology. But with excision, we have decreased risk of recurrence, better outcomes for pain, and also for fertility.